Welcome all, and welcome to our session. The title of our session is Social Protection Responses to COVID-19, Moving Toward Inclusive Shock Responsive Systems. As a reminder, the overall aim of the session on social protection track is to highlight response efforts, gaps, and approaches and opportunities for inclusive recovery. My name is Flora Miamba. I am an expert in social protection and gender based in Tanzania. I am also a master trainer for Transform Training, which is a social protection training on social protection flows. Socialprotection.org is the platform for Transform. You can visit and get more information on that. So the format of our session is Hard Talk Show. This is an innovative style to share and receive information. I'm not an expert on that, but I'll introduce you in a minute, Pamela, who will tell us all about how it works. For now, I would like to introduce Dr. Abebe Haile Gabriel, who is the acting Director General for FAO Regional Office for Africa. Dr. Abebe will give us some opening remarks. He has more than 30 years of extensive experience at national and international levels, focused on agriculture and rural development in Africa. He has worked through the African Union as well as FAO, among other many reputable organizations. I'll not attempt to say everything about his experiences in half a minute. Please join me in warmly welcoming Dr. Haile Abebe for introductory remarks. The floor is yours. Welcome.
Thank you. Thank you so much for that generous introduction. Dear participants, colleagues, on behalf of the Food and Agriculture Organization of the United Nations, FAO, I want to extend a warm welcome to all of you who have joined us for the first session of the social protection track for the Cultivate Africa dialogue. I want to especially thank the African Union and Hallpax for offering FAO the opportunity to chair the social protection track. This is an important indication of your trust in FAO, but also a call for our leadership and continued efforts to champion social protection as an essential aspect of ensuring food security and nutrition, even in times of crisis, and strengthening rural livelihood resilience to reduce poverty for all. It's important to highlight that this conference is organized in follow-up to two major meetings organized under the African Union leadership, aimed to focus on COVID disruptions, impacts, and response. The first among ministers of agriculture in April, and the second among the African ministers responsible for agriculture, trade, and finance, resulting in the July African Joint Ministerial Declaration and Action Agenda on the impact of COVID-19 on food security and nutrition in Africa. I underline that the action agenda commits to, among other things, expand and improve social protection programs for income support, supplemented by emergency food assistance where needed, and provide nutritionally balanced diets through public interventions and social protection programs to ensure that immediate food needs of vulnerable populations are met, and to adjust existing social safety net programs to meet the needs under COVID-19. In this regard, FAO has organized two sessions that bring together a wide range of partners from government, UN agencies, and civil society, including producer organizations, all of whom are key stakeholders operating in the social protection arena, notably in rural areas, to share examples on more inclusive and sustainable response and recovery approaches and interventions to address impacts of the COVID-19 pandemic and other crises that regularly affect this region. The fact that there is a dedicated social protection track for this important event is a testament to the critical role that the social protection is playing as a response mechanism protecting the food security and livelihoods of rural households from the health, social, and economic impacts of COVID-19. Social protection is receiving more attention than ever before on the continent, having played a prominent role, particularly during the immediate COVID-19 response, to provide food and cash relief assistance to the poorest. In fact, 84% of measures implemented have been social assistance programs, providing cash or in-kind transfers, mainly of food. What we have remarked, however, is that despite the rapid and extensive social protection responses across the continent, national systems were not ready to handle a crisis of this magnitude. Prior to COVID, social protection in Africa had the second lowest percent GDP investment of all regions globally, at just 5.9% GDP, as compared with the global average of 11.1%. Additionally, on average, across countries, only 10% of the population in Africa was covered by social assistance programs. The needs that have arisen as a result of COVID-19 have strained underfunded and underdeveloped systems. COVID-19 impacts have been harshly and deeply felt in both urban and rural contexts, not only by existing poor and marginalized populations, but now by a new cohort of additional vulnerable population groups who are directly being affected by containment measures, income losses, and economic downturns. Many have been left out of the initial responses to COVID-19, despite being among the populations in greatest need. These include informal rural workers, notably in the agricultural sector, who generally lack income protection typically provided to formal sector workers, as well as refugees and migrants, who are typically excluded from national social assistance and health insurance programs. Now is a good time to look back, to examine and analyze these early responses, identify gaps, and look for ways to strengthen national social protection systems, making them more inclusive, responsive, and fit for purpose to support resilience for different categories of the population. This is vital to moving forward for enabling the recovery efforts and for strengthening shock-responsive social protection systems moving forward. With the spotlight on social protection and the widespread recognition that social protection systems are central to COVID-19 response and recovery, we consider this a great opportunity to build back better. I wish to highlight three particularly important points here. First, we must strengthen the shock responsiveness of systems to ensure an inclusive and timely response so that those affected by crisis are protected and do not become more vulnerable or fall into a long-term cycle of poverty and food insecurity. Second, partnerships are fundamental between government, civic society organizations, including producers, private sector, among others, UN agencies, development partners, and financing institutions to encourage the cooperation and linkages that facilitate effective response and recovery, economic inclusion of the poor, providing a pathway for them to engage in productive activities. And third, investments are critical to bring to scale needed social protection coverage across the continent, appropriately targeted to support particularly poor and vulnerable households in becoming more resilient, ensuring food security and healthy diets, viable livelihoods, and preventing a backslide in achieving the Sustainable Development Goals and the African Union Agenda 2063. Throughout the COVID period, FAO with partners has been relentlessly advocating and supporting efforts to draw attention to the risks of vulnerable groups, including informal workers and marginalized populations, such as migrants, refugees, and particularly agricultural workers, including farmers, fisherfolk, force-dependent communities, processors, and informal traders, who often lack access to social protection services and are not included in national registries. These groups are facing notable effects in food insecurity, malnutrition, losses of income, including remittances, and decreased purchasing power. As example, the most recent October FAO WFP early warning analysis report that in East Africa, due to COVID-19 in combination with other prevailing crises and risks, the number of highly acutely food insecure people could increase by 73% by the end of 2020, from 24 million pre-COVID-19 to 41.5 million. FAO with other partners are bringing to focus these risks and promoting interventions that are accessible and well-tailored to meet the needs of these populations and rural communities. The current COVID-19 pandemic has revealed the dire importance of ensuring inclusive, timely, and adequate response to crisis. As such, we must work together to identify innovative and scalable solutions to support rural populations throughout response and recovery periods. In this session, we will hear from government, development partners, and the civil society about their experiences with COVID response and engage in an open, dynamic discussion, highlighting gaps, challenges, and good practices to improve inclusivity and strengthen shock responsiveness of national social protection systems. In addition, importantly, our aim is that this exchange will inform and orient the African Union, member states, and also partners in the region in strengthening the social protection agenda moving forward. I thank you all so much again for your participation in this session and your contribution to this wider effort. We look forward to future partnerships. I thank you.
Thank you so much, Dr. Bebe, for those kind and wise words for us. I will not try to summarize everything, but I caught the 3 key points that you shared with us, including the need to strengthen inclusive social protection, particularly for vulnerable groups, so that they don't fall into further poverty, but also partnership, particularly of key stakeholders with like minds in investing in social protection, but also the last key one, investing in social protection and scaling up best practices throughout. I think all of the participants will join me in thanking you so much for that. And now I would like to welcome the host for the Hard Talk show, Pamela Pozzani. Pamela is the senior rural sociologist for FAO Regional Office for Africa. She has more than 30 years of experience working on inclusive multi-sectoral rural development in many countries of Africa. She has worked with a range of organizations, including NGOs, universities, research institutes, UNDP and FAO, and so many others. Thank you, Pamela. You're welcome. The floor is yours.
Excellent. Thank you so much. Welcome to all. Welcome to all. Thank you, Flora, and definitely a most sincere and warm thank you to Dr. Abebe, our Assistant Director General here in ROF, who is definitely sets the vision and the support for the African Union and for all our government partners and our civil society. So let's get right down to business. This is Hard Talk. And I think most of you know what Hard Talk is all about. It is to ask the real questions, find those gaps that Abebe has brought to the front table, and hear from countries, from our partners, from our civil society partners themselves. Why did they make the decisions they've made in terms of COVID response and social protection interventions and support to the rural populations? Why did they make those decisions? How were those decisions rolled out? What were the results, the impacts, and most importantly, what are the gaps? And how can we learn from this and move forward? Okay, great. So our panelists are ready for the hard talk. Let's get started. Why don't we start with civil society? Mr. Ahmed Abdi. Abdi, come to the front room here with us. Ahmed, you are the CEO of the Arid Lands Development Focus, and you are the network convener for the AZAL network, which is the arid, semi-arid lands mostly in the southern eastern Africa region. So we are honored and delighted to have you with us. Let's get started. First question, we'll throw it out to you first, Ahmed. Ahmed, you have some projects, I think a big one in Kenya in particular, and other programs that you're linked with. Tell us, please. Now, in your COVID response interventions, did you build on and leverage existing social protection systems and programs in place? And if you did, tell us about that. How did you leverage and build upon and revise or adapt the existing systems for this crisis and shock of COVID? And if you did not build upon existing systems, please tell us then, how did you go about it? How did you design? How did you implement if there was very little already there on the ground? Ahmed, over to you.
Thank you very much, Pamela. And I just want to highlight that the COVID response that we are talking about came on top of other disasters that happened just before it. And we are talking about flooding that had affected food growing populations. Also the locust invasion. And now we have got the COVID. This brings to the core the aspect of vulnerabilities and the levels communities had already been exposed to. So what happened is, yes, the response we are doing covering around 20,000 is a response to the triple threat people are facing in the country. It has been done in quite a huge location. And yes, it layered on the existing social protection systems. But however, because COVID was bringing in more vulnerabilities and more people who were not vulnerable before were coming on board, the aspect of ground truthing with communities had to be layered in. And so we had come up with a 7-layer model where communities are asked to make the lists of vulnerable persons or to be put into a program. Thereafter, they were given the opportunity to do the verification themselves, because the committees that were selected from the community were already inclusive. We had men, women, persons with disability, and a number of other criteria. Once the list they developed is taken back to the village, because of COVID, you can't do the public validation processes, then we were posting only the names as agreed with them. They were going through, calls were coming in, and they were saying, so-and-so is not vulnerable, so-and-so is vulnerable. Thereafter, a registration of the beneficiaries was happening. This was again validated against the existing social protection registers to be sure who is in it. And when we look at the social protection registers themselves, the individuals who are on the social registers, who are close to 1.3 million households here in Kenya, across the HNSP, the Hunger and Safety Net program, and the Inua Jamii in Kenya, they are getting 2 cycles in 1 month. So it means the next month they have nothing. So they still, if they find themselves in the list, they are still getting the month which they were not getting the government stipend. Once that verification is done, the registers are validated and payments were being done through money transfer systems. And so, yes, we have layered on it. We have brought in these aspects of ensuring the most vulnerable people as a result of COVID are brought on board. Thank you very much.
Ahmed, I want to dig a little bit deeper on one of the, an important question for you is there were existing registries. I understand that was a national registry. There were 1.3 million people in that registry. So now I didn't quite catch. So your committees are adding on the new vulnerables. Is that how you're doing it? Over to you, Ahmed. Could you please explain that a little bit?
Yes, thank you. In each of the different counties, for us to identify the localities that have been hit by any kind of disaster. Then we do a key informants with the key departments or different other agencies to be able to identify and zero down on a village. Once you get to the village, then you're able to give the committee the responsibility to be able to identify the vulnerable persons. The register for that village for those different social protection is availed and available. And so you go to the departments in charge, you do a check against it.
So you are essentially adding and adapting the registry. Is that, I mean, those people
Yes,
will then
so
be put on the registry. Is that correct?
What now normally happens is once the civil society organizations are able to do that process and pay, the registry is availed to the government for uploading. So that addition can still be counter-checked, whether it has they have found themselves registered or not.
Very interesting take-home point there. It's civil society who's building registries a little bit on their own, perhaps not fully coordinated, but then the idea is that you're contributing to a national registry, if I get the point. Very interesting. Okay, let's move on and let's move to our WFP colleagues. I think we have here in the room Magdalena Moshi. Magdalena is our esteemed, not only Nobel Prize, congratulations again. And we know that WFP is representing us all of us here working towards the same objectives and goals. So bravo to WFP. We must say that. A big congratulations. Magdalena, you are the Deputy Director of the Global Africa region, particularly liaisoning with AU and the ECA. So it is really a pleasure and a privilege to have you with us, our sister agency, WFP. Magdalena, you're most welcome. Let me throw the same question out to you and hear a different angle, different lessons learned. Magdalena, you have been, I am sure, leading a number of different types of social protection programs, particularly in the context of COVID. Have you, these COVID new sort of shock responsive programs that you have built and implemented during the COVID context as a response, were they building on your already ongoing programs in WFP? Were they new programs? How did that work? What does that look like? Could you give us a soundbite and help the audience understand a little bit of how WFP addressed this massive problem? Over to you, Magdalena.
Yeah, thank you very much. You know, when the pandemic hit the continent, WFP's priority was, first of all, to support the governments in sustaining life-saving assistance for the vulnerable people in their countries. WFP supported, governments to move very quickly to adapt the operations that ensured the ability to reach vulnerable populations through existing social protection, programs, as well as safety nets. We all know that the COVID-19 pandemic, placed significant stress on food systems, as Abebe was saying, especially in lower and middle-income countries, as well as the fragile states where, food systems were already flawed or disrupted before the pandemic threatened the food security and livelihoods of the vulnerable persons. And therefore, WFP's approach was to, to continue maintaining or sustaining the life-saving assistance, to scale up, to reach additional beneficiaries on the brink of acute food insecurity due to COVID-19, and also to support, governments with their social protection systems, the existing one. In order by providing technical assistance and advice. Over the months, WFP has supported governments to reinforce, their existing activities while adjusting, programs to new realities. For example, when it comes to cash transfers, sizable cash transfers programs for poor people in urban areas in several countries have been initiated, in countries like Zimbabwe, Kenya, Somalia, Ethiopia, Lesotho, DRC, and many others. So just to give an example, more specifically, in Lesotho, for example, in collaboration with the government, an urban response program in 5 districts was initiated, in which households received money transfers of about the value of $50. I also wanted to quickly touch upon on when it comes to school feeding. As we all know, quite a number of governments in the continent, they do have their own national school feeding program, as a safety net. And when the pandemic hit, almost about 65 million children across Africa missed out on school meals due to the school closures. And for many who come from the poorest countries, these are the only meals that they count on. And therefore, WFP and UNICEF, and other partners have been working to monitor school feeding during school closures, preparing governments when they reopen. And also, WFP and its partners supported governments to come up with more innovative way on providing school meals. Like, for example, in Niger, school meal stocks were repackaged and distributed as, take-home rations, while in Republic of Congo, food stocks at schools were repackaged in 2 months rations for school children and their families. I will stop here. Yeah.
Very good, Moshi. Very, very good. A very comprehensive repertoire of examples. Let me challenge you. A little bit of hard talk here. Magdalena, please tell us. So you've given all this support. You've actually probably greatly expanded the cash transfer, the assistance to the most vulnerable, particularly in urban. But the urban-rural divide is so fuzzy and gray now, we don't know what that means anymore in terms of a rural transformation. But Magdalena, what's your take on, okay, so even WFP and other development partners are probably greatly assisting the governments to finance and resource this. What's next? How long does that go on? What happens when maybe WFP pulls back after the crisis and shock? What's in place? Are governments, in terms of your experience, you've been talking to so many of these governments, Lesotho and so on, what's your take on what happens next and how governments will take on this major burden? Over to you, Magdalena.
Yeah, thank you very much. We all know that for the existing social protection schemes to be shock responsive, like, governments have to ensure that social protection schemes are comprehensive. They cover as many vulnerable people as possible. They are well resourced, and also allow, flexible in enrollment to keep, functioning well during a major crisis. What we are seeing, some of the challenges when it comes to social protection in Africa is, number one, it's number one, the low coverage. In most cases, the coverage is less than 10% of the poor and the vulnerable population. Another one is the weak delivery of social protection systems and safety nets. And the third one as Abebe had mentioned, is the exclusion of refugees, returnees, migrants, and displaced persons. And
So
lastly,
Magdalena, let me jump in on that one. What is WFP doing to strengthen coverage and the efficiency and the effectiveness of systems? What is your program? What are your programs in the region? What are you doing? Give us one example.
Yes, WFP is really providing capacity development, especially in the areas of like assessment, looking at supporting governments to be able to assess, the situation, to look at who is at risk, and also, providing advice on the funding sources, in a sense that, the government, in the sense that, as you know, in most countries, the governments have committed to, for example, fund at least 2% from their GDP, but yet and domestic funding is coming from tax revenues and other donor support programs, and therefore
Right.
it's about time for them to see how best they can look for funding from other sources. There are some good practices from various countries in which they've been able to allocate specific budgets for their programs. For example, the school feeding program in Ghana and also in Nigeria.
Exactly. Magdalena, thank you for that. It's sometimes a question of ring fencing and ensuring the finance and the political commitment is there. So we need to move on, but stay with us. Over to Linton Mchunu, please take the floor. And we're going to also, Linton, there you are. You're joining us. Linton, you are the director general, the director general, indeed, of the Department of Social Development in the government of South Africa. It is again a pleasure and honor to have you with us. So, Mr. Mchunu, let me pose to you the same question. What is your government? I mean, South Africa is very well endowed. You have a lot of political efficiency, capacity. So when the COVID hit the country, and we know you were hit hard there in South Africa, you were hit hard. What was your government response in terms of the broader intervention? What was the package? How did you build on what already existed on the ground? If not, what kind of adaptations and revisions and innovations did you bring in to the COVID context response? Over to you, Mr. Mchunu.
Thank you very much, Program Director, and thank you for the invitation to be part of this very important show engagement. Let me start by firstly outlining South Africa's social protection system. I think it's important that I deal with that quickly, and then I would then come to the specifics insofar as the question is.
You don't have much time. You don't have much time.
Okay, maybe let me then go to it. Okay, no problem. I think the important thing for us is that we through our social security agency SASSA, and together with ourselves as the Department of Social Development, we leveraged on what the president introduced, which was basically a social and economic relief package of around 500 billion rands, which translates to about $32 billion US. And in essence, that was to really cushion the most vulnerable in society that had suffered through COVID-19. And I think those efforts were really useful. What we did was through our SASSA system, we currently pay around 18 million grants, 12 million of which are actually children. So we leveraged on that system and we introduced a new program which was called a Special COVID-19 Social Relief of Distress Grant, which we paid to about 6.5 million people That was started in May. It was supposed to conclude in October, but the president has since extended it to the end of January 2021. And again, this is to assist the most vulnerable and the poorest in society. And I think what's happened is that from the 6.5 million people, we have about the majority of which of these are between the ages of 18 and 35, and the majority are actually male. Which in itself speaks volumes in terms of the kind of challenge that we have insofar as skills development in the country, because those would fall into a category which we call the NEET group, not in education, employment, and training. So that's the one challenge that we have, which we're still dealing with. We spent about 41 billion rand already using this process, and I think the important thing is that we use the infrastructure and the footprint of SASSA, because we have our post offices which are in every single city literally, and we are paying using vouchers in this regard, and people are able to collect these grants at either post offices, at retail stores, or at banks, and I think we've been able to use that particular footprint to do this work. But
Mchunu, let me jump in there. I want to jump in on something before you lose that thought. So I want to just carry that thought. January 2021, that particular program, the social relief, is going to end. What happens to those 18, 35-year-old young men, and we know who are desperately in need? All of a sudden in January, no more need? What is going to happen? What's going to happen? Tell us about that and the permanence of a shock responsive support. Could you please speak to us on that, please?
Thank you very much. Thank you. That's a very important question. I think what's important is that we were supposed to have ended this grant in October, but we took a decision through the guidance of the president to further extend it to January, noting the impact that this is going to make. Now, I know that after January, there is certainly going to be an outcry, but the reality is that we're dealing with a strained fiscus as a country. And we're trying to look at different measures and means. What the president has now introduced is a reconstruction and economic recovery plan, which is supposed to take the country further, having faced the challenges of COVID-19. And through that plan, we are trying to now push young people, especially that age group, into economic opportunities. We are focusing on infrastructure development, local economic development, but we're also leveraging on existing systems and trying to improve those, particularly in terms of increasing our energy capacity, so that we're able to get some young people into some of these areas. And we are building some what we call skills for the economy, so that young people are able to move out of the grant system, but into an economic system, an economic development system at least.
Absolutely. That is ideal. And you have just sent us some very strong messages: economic opportunity, reducing vulnerability through a sustainable system, the energy capacity, very interesting angle, skills development. In the long term, that's the permanent lifting out of poverty. Let me hold your thought there. Let's move over to Amina Darao. Amina, are you with us? I believe you are. If not, then we'll have to move back on. I think that we lost Amina. Okay, that's too bad. Amina was going to talk to us about some of the experiences in Somalia. Let's throw out another question. Let's talk about, very candidly, in a couple of minutes, each of you, please. I would like you to tell the audience, please, about the gaps. What were your biggest constraints in moving your agendas forward in terms of COVID response? And when you tell us what were the biggest challenges, one or two, if you could really pull them out, what would you recommend in moving forward, not only for your own programs, but to share with others, the do's and don'ts? So what were the biggest challenges you confronted, or the biggest hurdles? And then from that lesson, what would you recommend? Let's jump to, let's go back to Linton Mchunu. Linton, let's go right back to you, switch gears and tell us, So all that wonderful, I mean, you had some really great stuff there. Tell us the reality. What were some of the hard constraints?
Yeah, thank you. I will do the three very quickly. The one is integrating our systems as a government. When we were implementing this particular grant that I was talking about, we found out that the number of people were actually accessing other social relief measures or social protection measures offered by other government departments. And the fact that in some cases we're not able to verify against that, we had a problem of people double dipping, and we had a problem of people basically taking additional money when they shouldn't have, when that money should have been directed to other people. What we've done in this regard is that we've developed a national integrated social protection information system, wherein we are able to streamline our social support as a government on the whole from other government departments as well. The second one, which is an important one, we used to provide food parcels to the most vulnerable and the poorest. We realized that providing food parcels in the manner in which we used to, but also we used to provide plates of food to the most vulnerable in all our communities. We've shifted that because we're avoiding congestion and so on and so forth. We are now providing a knock and drop off service where we provide the food parcels and we drop them off at the household, and then people are able to access the food in that regard. But equally important, we are looking at a hybrid model between a food parcel and a food voucher. The problem with food parcels is that they're expensive, they take long because you still need to package them, etc. They're labor intensive, they're expensive, they don't always speak to the dignity of people in that you would be giving them the same thing over and over a long period of time. We're shifting some elements of this and we are moving this to a hybrid model. We're providing food vouchers where recipients are able to access food using vouchers. They can access not just food, but they can also exchange for gas. They can exchange for airtime and electricity and other related matters. And I think this is very important in instilling dignity in the people that we serve. Lastly, and this is probably one of the most important one, we've had to ensure that we build a capacity of the state. We've had to be able to ensure that as a government, we are responding with resilience, we are responding with agility. So what we've done is we've augmented some of our programs and some of our systems, and we've automated some of them in this regard. And we've provided, for example, this grant that I'm telling you about, all 6.9 million people were able to access that grant virtually or digitally rather. They didn't have to go to a particular office and wait in long lines, etc. Every application was done online. So that's the significance. And I think more importantly, as an organization, we've had to unlearn and relearn. Some of the skills that we have become dormant because of COVID-19. So what we've had to do is invest heavily in the kind of people that we want as an organization. So we are now looking at analysts, we're looking at analysts and economists to help us with modeling. We're looking at business process re-engineering specialists so that we are able to automate majority of our programs and get our people into the fourth industrial revolution, as it were. Thank you.
Okay, let me ask you a question. Let's dig down on a question of the integrated systems. Okay, so what's the game plan? Apparently there are perhaps a plethora of information systems. What are you doing? How are you going about the integration of diversity of systems?
Thank you very much. In the system that we are working on, we are looking at a system that will integrate young people who are in school that are already getting support from government. So we have a sense of people through, for example, so when young people are accessing support for school, for example, we should have a sense of the kind of support that they're accessing so that we're able to not enable them to further benefit when that money can be used for other people. We're also using other systems in terms of the military. We are using systems of persons who are in prisons, for example, but we're also using the SARS system, which is the revenue system. So when people have already received a payment, because everybody pays tax in the country, so the revenue system has a database of everybody who's been paying tax, and we're able to then get a sense from there when last the people were getting paid, and we're able to say that this person has been paid already, therefore they don't qualify for this particular system and so on.
But when there are different programs going on with different registries in the country, are those registries able to speak to each other?
Now they will be able to. Previously they weren't, and now we are beginning to augment these registries. We are able to tell. In fact, we're even able to tell from the child that we support through the child support grant from when the child is born. and they come out of the system at the age of 18. We're now able to tell that. We're also able to link this to other social protection systems. So indeed, we're beginning to integrate this, and it's going to assist us in reducing wastage on the fiscus, but it also assists us in ensuring that we have a good database of everybody in the country, particularly the most vulnerable.
Very good. And it's a bit of what we call the life cycle. You can track over the life course, particularly when they're younger, and provide assistance as needed. Exactly. Very, very useful, and perhaps a model that will have some South-South exchange where you can really show other countries some of the, once you're really up and running strongly. Excellent. Thank you so much. Let's go to Ahmed. Ahmed, back to you, Abdi. Let's be very frank and very transparent. What were the challenges? What, Abdi? What were your difficulties? What did you really wrestle with in terms of getting your programs out there? Over to you, Ahmed.
Thank you very much again for coming back to me. One of the major issue was the level of need. As we go to the communities and work with the different persons down there, then the numbers are huge. So getting out the most vulnerable with the little you have will be the tasking aspect. So it needs time. So for that kind of aspect, that was one of the key things. The second other one.
But you did not, you talked about, excuse me, Ahmed, you talked about the constraint. What is your conceptual, what's the solution? What would be the recommendation?
Yes, I'm going into it. So based on that kind of an approach, then we need to have a single registry system that is of social protection, which is able to scale up in time of need, ability to scale up the amount of money being given to people depending on the different level of disasters they're exposed to, and the level of stress. Let's say if the stress is a bit mild, then what is the amount? If it is extremely hard and severe, how much is it? Then the duration of the shock. For this individual to be getting, how long will they be getting these things? And what is the package? So that if we are doing a shock responsive model, then it will work. Then the other aspect is real-time data. Real-time data, that data will be aged. The number of persons that are falling out at different times of shocks are a lot. And I'm insisting on the need to engage local frontline actors from a localization agenda approach, such that we are there on the ground, we're able to reach fast, able to know about the community and help in real-time data availability together with the very many unemployed youth. The other key thing that
Ahmed, and let me just ask you, have you already started some of this work? Are you starting to do some modeling where you would have, I guess, some triggers or some criteria for when it hits a certain level of stress? And are you working on this now?
Yes, the system is already designed on that. But for COVID, for example, in urban areas, the shock, when the analysis was done, the amounts were higher. And that is what I was talking about. So from that, then the system needs to be a holistic approach to the whole country, so that then it works of the different actors working in different spaces, whether it is the refugee IDP groupings, whether it's the urban cluster groups, whether it is the ASAL regions where we are talking about, then the thresholds and the triggers need to be very clear. The real data and who is vulnerable and who's falling off needs to be up to date. And so that then we give the right thing. The other one is the government needs to have ready funds to facilitate the shock responsive capability. That anticipatory funds must be available. Otherwise, we cannot be talking about doing shock responsive, and you need to give people who are in crisis funds, and there's nothing in the covers. So that money needs to be in place. So I'll leave it there.
That's very, very interesting. I think that would be something that you would be of great interest to other countries, of looking at your system of modeling and the criteria and the triggers and the different categories and groups and the context of each, because that all matters and it all fits in. but that's really site specific and adaptive shock responsive. I think that's brilliant. That's really impressive. So I think that more to share on that. We expect some documents out from your organization of the how-tos, how you've actually created that. Let's go back to WFP. Magdalena, despite the brilliant work that WFP has been doing, particularly at the crisis response, the real survival, also those periods. Tell us what are the challenges? What are the challenges with the governments, with the communities, with the systems, with your own operations? Give us an insight to our Nobel limitations, and what have been the hard confrontations that you've met in implementing your programs. Over to you, Magdalena.
Yeah, thank you very much. First of all, I would like to start with looking at the short term and also some of the challenges. What we are seeing in the crisis like COVID-19, there's an issue of management of social protection systems, and also in terms of scaling up and funding. And therefore, what we are recommending is that it all falls in mostly in the responsibility of the governments, with support from partners, that government should make efforts in improving delivery systems of their social protection programs, so that they can reach the vulnerable populations quickly, with the potential of scaling up to include new people. Government should ensure that food and nutrition needs of the vulnerable populations in their country are met by scaling up, safety nets such as, school feeding and cash transfers, for example. On the longer term, again, what we were seeing is that there were no appropriate plans or linked to disaster management authorities, and therefore government should really consider integrating their national social protection policies into their national development plans. And lastly, there's an issue.
Magdalena, excuse me, hold that thought. I want to just check on that. So you're saying in the national development plans, is that what I heard you say? That the sort of disaster risk, disaster shock element should be, fundamentally in the national development plans. Is that the message?
Yeah, both. Yes, yeah. Because, for example, in the fragile states, especially those with high-level food insecurity and hunger, some of them, even like if there's a social protection system that exists, is almost more on the formal public sector, in terms of maybe pensions, but and therefore, as they develop their national development plans, and also with their disaster risk, they have to ensure that they include, their social protection initiatives in them, including elements of climate shocks, for example.
That's a very strong message. I'd really like to tease that out, is that social protection and this kind of risk management should be integral as a permanent, fundamental element of national development plans, even the national agricultural investment plans, the NIPes under CADUP and so on. I mean, social protection should be a permanent element in those systems. Very good. An important message. What else were you going to say? And then we'll have to tie it up, Magdalena. So any final recommendation?
Yes, yeah. Also, in relation to data availability and information, I think this is what we are all grappling on when it comes to COVID-19. And, for example, WFP and FAO came up with hot spots of food insecurity. And therefore, it is very important for social protection system to be linked with early warning systems as well for vulnerable groups. I think
Indeed,
I'll stop here.
indeed.
Yes.
And I know that we are working very, very actively on those fronts. The humanitarian, I mean, the whole wider network should be working on linking that early warning, preparedness, and permanent social protection. Excellent messages. Thank you so much, Magdalena. Thank you so much, Ahmed Made. Thank you so much, Linton Mchunu. And I think I am forced to pass the floor back to Flora for a few final comments and final words. Flora, the floor is yours.
Your panel, I have to say this was so great. Thank you for this enthusiastic and active learning that you have given us. It is so specialized. You have to tell me next time how you select panelists who can give us all these information and education within very short time. We enjoyed it. We have learned a lot, and thank you for giving us some highlights of what is next. From what I picked, I think what is most important, just to add on from what you have, is the need to build permanent and sustainable structures in social protection systems, so that when a shock comes, we are prepared. It's like preparedness of whatever comes at any time. We have systems that we can just pick up and continue. I'm glad to hear South Africa are already building that, and they hope that coming any other shock, we believe they already have that system in place. We also have learned a lot from Dr. Abebe and from the discussion on the point of coordination and integration. This is very key because we don't want to overlap and then waste resources, energies, times, capacities. We want to integrate and build an integrated social protection system to save the majority who are left out, the vulnerable people in our communities. But the last one maybe is the comprehensive and nationally based financing system, investment in social protection. We have been so much dependent in terms of building social protection financing. We need to move on and then get to the point where our national governments can be innovative enough to finance social protection from nationally owned sources. So I think just to finish from what has already been said, I will just give those 3 comments. And finally, it's just to thank everybody, Pamela and your panel, the speakers, Dr. Abebe, the technical people, but all participants. Thank you so much. This was great. I also had fun listening to all of you, but the rare opportunity to be in control and moderate the session. This was great. Thank you so much. I look forward to seeing some of you tomorrow when we have another session in social protection by FAO. Thank you.